So let us quickly recap the immunobullous disorders part 1. So what is the classification that we have used to classify the immunobullous disorder? It is on the basis of level of splits. So we have got intraepidermal split, intraepidermal within the epidermis, where we have got two subtypes. One is subcorneal, second is suprabasal, that is above the basal layer of keratinocytes, below the stratum corneum, subcorneal and suprabasal. The third is dermoepidermal or subepidermal, that is between the epidermis and dermis. So there are various subtypes here, various examples that we should know of. So can you tell me 4 causes of subcorneal split? Number 1, pemphigus foliaceus. Number 2, 4S, that is staphylococcal scalded skin syndrome, and we have got miliaria crystallina, that is due to sweat duct obstruction, and we have got bullous impetigo. So bullous impetigo and staphylococcal scalded skin syndrome because of Staph aureus. This is pemphigus foliaceus, that is autoimmune blistering disorder with subcorneal split. Okay. Now mnemonic, we cannot forget the mnemonics. The mnemonic for subcorneal split was a foodie mnemonic. I had popcorn, fries, burger with soft drink in a movie. So popcorn is for subcorneal split. Fries, F for foliaceus, pemphigus foliaceus. It is not vulgaris. Subcorneal is foliaceus, vulgaris is suprabasal. So foliaceus, fries, burger is for bullous impetigo, and we have got soft drink with burger, fries in a movie. So M for malaria. Clear till now? So miliaria crystallina. Clear? So popcorn, fries, burger, soft drink in a movie. You cannot forget. Right. What about this is not subcorneal, this is suprabasal. So again, suprabasal intraepidermal split. What are the 3 important examples? Suprabasal split. Veg, besan vada, another foodie mnemonic. So we have got veg is for pemphigus vegetans. So various subtypes of pemphigus we have discussed already, but some are subcorneal, some are suprabasal, so you should know. So pemphigus vegetans. Then we have got besan, besan is for basal, suprabasal. Then we have got V is for vulgaris, pemphigus vulgaris, and DA, vada, Darius disease. Clear? So pemphigus vulgaris, Darius disease, and pemphigus vegetans. Okay. Now beautiful pictures, please revise it again. So we have got a case here where we have got scales and crust. You can see here multiple crusted plaques, wet plaques with oozing. So this is a case of pemphigus foliaceus. Pemphigus foliaceus. So pemphigus foliaceus, we see subcorneal split, and the manifestation, that's why, will be crust and superficial erosion, because the level of cleft is superficial. Whereas if we compare on this side, we have got flaccid fluid filled blisters, and this is a case of, please diagnose it immediately, pemphigus vulgaris, flaccid blisters. We have got some blisters more, then we have got erosions also. So erosions plus flaccid blisters seen in which type of split? Suprabasal split, and flaccid bulla is the manifestation. Why flaccid? Because we have a layer of epidermis above that is forming the roof of blister. Now the third case scenario here, you can see the difference. Flaccid bulla, this is tense blisters. So tense fluid filled blisters, this is seen in subepidermal split. Why tense? Because we have got a whole layer of epidermis above and dermis below. Flaccid, why flaccid here? Because we have a thin layer of epidermis above and we have got basal keratinocytes below. Here we have got only stratum corneum forming the roof, the remaining epidermis is below, that's why it will rupture forming crust. Clear? Now beautiful, please recollect, what is this? Skin histology. So I have told you already, skin is like a wall. So our epidermis is like a wall where we have got cement which is attaching the keratinocytes together. The most important is desmosome, that is for keratinocytes. Another you cannot forget is hemidesmosome, that is for epidermis and dermis. Now the most important desmosome you cannot forget is desmoglin. Desmoglin 1, which is expressed where? In upper layers or lower layers of epidermis? Upper layers of epidermis. Desmoglin 3 is expressed in lower layers of epidermis. What is the mnemonic? 1 comes first, so it's upper. 3 comes later, so it's below. And we have got BPAG, which is a type of hemidesmosome. So BPAG, dermoepidermal. So if there is any problem in desmoglein 1, what will happen? Cleft, crack in the wall. Where? In the upper layers of epidermis, leading to subcorneal cleft. Desmoglein 3, antibodies against desmoglein 3, problem, crack. Where? In suprabasal region, lower layers of epidermis. If there is problem with BPAG, dermoepidermal cleft. Clear? Clear with the basics? Right. So, what are the 4 types of desmogleins? 1, 2, 3 and 4. Number 1 is very important. It is expressed in upper layers, whereas number 2 is expressed in heart. दो दिल मिल रहे हैं, remember the mnemonic, 2 hearts meeting together. And 3, where is 3 expressed? In lower layers of epidermis, plus, very important, plus it is also expressed predominantly oral cavity, you cannot forget this. So 3 is for 2 things. So any problem with desmoglein 3, where is desmoglein 3 affected? In pemphigus vulgaris. That's why in pemphigus vulgaris we see crack in the epidermis, flaccid bulla, intraepidermal cleft, plus oral ulcers. So in pemphigus vulgaris we see oral ulcers also. That's why, right? Desmoglein 4 is in hair follicle. Remember the mnemonic alphabets. 4 starts with F. Hair follicle is F. Clear? Right. Now, differences between the common types of pemphigus. So, common types of pemphigus, we have pemphigus vulgaris, we will label it as PV, and PF is for pemphigus foliaceus. So, what is the most common type of pemphigus? Vulgaris. Why? Because the meaning of vulgaris is common. Psoriasis vulgaris is the most common type of psoriasis. DSG, desmoglein 3 more than 1. So, the antibodies which are produced in pemphigus are targeted against desmoglein 3 most commonly, followed by desmoglein 1. Whereas in pemphigus foliaceus, it is desmoglein 1 only. So, in pemphigus foliaceus, antibodies are against desmoglein 1. So, can you remember the rule of alphabets? F comes first, V comes later. That's why vulgaris is for desmoglein 3 mainly, foliaceus is for desmoglein 1. Clear? Okay. Now, identify, please identify. So, we have got flaccid fluid filled blisters here. So, let us see. So, we have got on one side flaccid blisters, on the other side crusted plaques erosions. So, the level of cleft is deeper here, that is suprabasal intraepidermal cleft. The level of cleft here is superficial, subcorneal split, that is also intraepidermal. So, what is the diagnosis? Pemphigus vulgaris is superficial or deeper as compared to foliaceus? So, pemphigus vulgaris is deeper than foliaceus because it is against desmoglein 3. That's why this is a case of pemphigus vulgaris, whereas the superficial one is pemphigus foliaceus, which is against desmoglein 1, which is superficial, right? So, scale crust, cannot forget pemphigus foliaceus, superficial, right? Flaccid bulla and erosions, pemphigus vulgaris. So, alphabetically F comes first, it is superficial, V comes later, it is deeper, right? Okay. Now, oral ulcers, this is very important clue in case scenarios. So, where do we see oral ulcers? Please tell me what type of desmoglein is expressed in oral cavity, mainly desmoglein 3, and in pemphigus vulgaris desmoglein 3 is targeted. That's why we see oral ulcers in pemphigus vulgaris. Very important clue, right? Okay, rapid fire round. Please tell me the diagnosis. This is not vulgaris, this is not foliaceus. We are discussing the rarer types, that is the other types of pemphigus. So, a lady with malar rash like picture, but these are crusts, right? So, these are not erythematous rash only, crusted plaques with some erythema in malar region, looks like SLE, but it is not SLE, it is pemphigus erythematosus, right? So, pemphigus erythematosus, another name is senior Usher syndrome. So, eponym, cannot forget this, It is a subtype of which type of pemphigus? Foliaceous or vulgaris? Foliaceous. How to remember? Rule of alphabets. So erythematosus starts with E, foliaceous with F. Alphabetically they are close together as compared to vulgaris. So F is closer to E. That's why we have got foliaceous and erythematosus related types. Okay. Now please identify crusted plaques. Not crusted really, they are vegetating plaques, right? So vegetating plaques in axilla. This is a case of pemphigus, which type? Vegetans, vegetating plaques. So vegetans, subtype of vulgaris. Why? Alphabets, V is near V, simple. So vegetating plaques in axilla and groin, pemphigus vegetans. Okay. Now drug induced pemphigus. Please tell me drugs that are responsible for drug induced pemphigus. The mnemonic. Mnemonic is CRAP. CRAP. So captopril, rifampicin. We have got another ACE inhibitor. Captopril is important example of ACE inhibitor, and penicillamine, which is the most common, which used to be most common, right? So clinically again, please tell me, it is a subtype of what? Foliaceous more than vulgaris. So D drug, F foliaceous, they are close together as compared to V alphabetically, right? Okay, so Brazil again. So we see a special type of pemphigus in Brazil. So it is endemic in Brazil, that is known as endemic pemphigus. Another name is Fogo selvagem. It is a subtype, resembles clinically pemphigus foliaceous. So pemphigus foliaceous again, mnemonic E or Fogo selvum, F is near F. Clear? Okay. Now we have got a patient who presents with severe oral ulcers. Which type of pemphigus you should suspect? Severe oral ulcers. So paraneoplastic pemphigus. Malignancies associated, you cannot forget non-Hodgkin lymphoma, which is the most common paraneoplastic association pemphigus, right? And we have got criteria. Criteria are important. Handheld criteria used for diagnosis of paraneoplastic pemphigus. And severe oral ulcers, you cannot forget, is a manifestation, right?